Next speaker is Dr. Krishnapriya K, free paper 49.
Good afternoon. My paper presentation is Optic nerve toxicity in drug-sensitive TB patients on a daily fixed-dose combination anti-TB drugs. For the rational study, this RNTCP has begun implementing daily fixed-dose combination as a base-based regimen, and we observed an increase in number of ethanobutyl toxicity cases in our OPD following the implementation of FDC regimen. The purpose of the study was to find the incidence and to evaluate the visual function. So the aim to assess the incidence of the optic nerve toxicity in TB patients on a FDC regimen and to describe the pattern and time of onset of optic nerve toxicity from the baseline. And the study design was a prospective study with a sample size of 100 patients. And all patients who are diagnosed as pulmonary and extrapulmonary tuberculosis and who are planning to start daily FDC and who presented to the OPD in a tertiary center for a period of 1 year. And the exclusion criteria, which includes all multi-drug resistance and extensive drug resistant category patients who already received TB drugs, and any media opicitis affecting vision and fundus examination, any history of intraocular or refractive surgery other than cataract, any pre-existing ocular and neurological diseases which affects the vision, and history of any intake of non-ethambutol drugs causing ocular toxicity like phosphodiesterase 5 inhibitors, amiodarone, etc. And first, the examination was performed as a baseline test, that is prior to the start of administration. Then after initiation of ATT, the patients were assessed at every month up to 6 months and 1 month after the stoppage. And each visit best corrected visual acuity using Snell's color vision by Ishara, slit lamp examination, fundus examination, and retinal nerve fiber layer by OCT and visual field by Humphreys field. And the data collected from each individual was entered in the MS Excel office after coding of variables, and the Wilcoxon test was done with the help of SPSS software. Ethical clearance was attained from IRC and IEC. So coming to the result, the study sample comprised of 200 eyes of 100 patients of newly diagnosed drug-sensitive TB. And the mean age of the study population was 47.6 plus or minus 16.6 years. So the main indication for starting ATT was pulmonary TB, that is 60%, then 28% was lymph node TB, 3% spinal TB, 4% abdominal TB, and 5% is pleural fluid. So we find that in 4 patients, that is 4%, the visual acuity declined from baseline during 4th month of follow-up visit. And in color vision, the study revealed that 10 out of 200 eyes, that is 5% showed defective color vision at 4th month, and that was found to be statistically significant. Similarly, the visual field defect was found by 4th month in 8 out of 200 eyes, that is 4%, and that also was found to be statistically significant. But in OCT, we find no significant changes in RF thickness in this study. So, the optic nerve toxicity we find at 4th month, 5 patients developed toxicity which manifested as loss of visual acuity, defective color vision, and visual field defects. So coming to discussion, in our study, the incidence of optic nerve toxicity was 5%, but various studies like Solo et al., the incidence was found to be 5.31%. Another study by Jitendra et al., it was found to be 9.5%. And a study by Sitao et al., the incidence was 2.24%. And study by Menon et al., the incidence was 19.23%. And a study by Gartpi et al., the loss of visual acuity from the baseline was noted at the 2nd month of follow-up. But in our study, the loss of visual acuity was noted from the 4th month of follow-up visit. Similarly, the color vision, defective color vision in our study was about that is 10 eyes. By another study, Gartpi et al., the defective vision was found in 16 eyes, and Solom et al., it was found at 10 eyes. Similarly, the visual field defect in our study was found in 10 eyes. In Gartpi et al. Study, it was found in 8 eyes, and Solom et al., it was found to be in 10 eyes. So coming to conclusion, the optic nerve toxicity was observed in 5% of the patients on ATT regimen in this study. And average time of presentation of optic nerve toxicity manifestation was 4 months post ATT. And this optic nerve toxicity gets manifested as loss of visual acuity, color vision, or visual field defects. So these are my references. Thank you.
What are the age of the patients who develop these problems, diminished vision? After ATT, you're told the range of the age and all, no? Which age patients had a problem of this?
This patient?
No, this 5 patients you told, no? Reduction. What are the ages of those patients?
Out of this 4 patients were the age of 45 to 50. say
How do you know that it's because of optic nerve? It can be due to some other cause also, no? The visual reduction.
but during this treatment period,
Now, that is okay. What the fixed dose means? What drugs you have given?
isoniazid, rifampicin, pyrazinamide, and
You should
ethambutol.
know that. Tell the dose also, no? You should have told about the dose of each drug. Then only you can assess. So out of 4, what could be a problem? Which drug may be the reason for these problems?
Mostly ethambutol, but some
Ethambutol normally the toxic dose if it is more than 25 milligrams, something like that. I got no. What is the dose of ethambutol in this fixed drug combinations?
it is 15 mg per kg per
15.
15 mg per kg per.
Then do you think it's some reason for that?
Sir?
It could be the reason or not.
Maybe.
How can you say? I am telling you, has developed some other problem for visual reduction. Color vision problem also maybe something else different.
But no other cause.
How can you substantiate? I'm asking you. That's all.
Because it's dose based on the weight. Newly drug regimen is based on the weight also.
Then you should not have given the drug, no, before that weight and all. Better to avoid those drugs rather than, Of course, nice study, but problem is what? You are not able to explain properly. That's the thing. Okay.
Visual acuity, color vision, and field effects. Which one affect first in toxicity?
In visual acuity, color vision will be first effect, I believe.
Are you sure?
You done fields for these cases. Field effects stored what? Field study. What effects they showed?
Shown centrocecal and central.
Sure. Taken or
Yes.